Hi, everyone, and welcome to another episode of Wellness Day, a podcast coming to you every Wednesday here from the Jehangir Wellness Center. My name is Kavas Jehangir. I'm here from the JWC studio. Today, I've got three letters for you. That's ENT. Today, I've got our leading Dr. Ravindra Sardesai here. He's our leading ENT at Jehangir Hospital. Thank you so much for being here, Doctor.
Thank you. Thank you for having me here.
Absolutely. I mean, we've done now over 100 episodes, and I have to say, embarrassingly, this is the first time we're actually talking to someone specifically about ENT. So thank you so much for being here.
Yeah.
Ear, nose, and throat, right? How did you get into this, Doc?
Have you ever wondered how these three organs came together?
Well, that's a good question, actually. That's actually a better question. Maybe you should be the
So
host.
why not eye, nose, and throat, or why not throat, nose, and arm, or something like that?
Yeah, that's actually a great
Because
question.
these three organs are connected. You know, when a smoker inhales smoke and exhales it through the nose,
Right.
so there is a connection behind.
Hmm.
Similarly, in the ear and behind the nose, the part which is called as nasopharynx,
Hmm.
there are tiny tubes called eustachian tubes,
Okay.
and they are all connected. So anything happening in one organ has a bearing on the other organ. That's how these three things have come together.
Okay.
And in the same way, you know, this is one branch
Hmm.
which nobody can avoid. Like you can go through your life without meeting a neurosurgeon or
Hopefully,
maybe a hepatologist,
Hmm.
but you can't go through life without being with us.
Yeah.
Everybody has either a cold sometime,
Right.
either a throat pain or a earache.
Yeah,
Everybody suffers through that. So our branch caters to like
Most
a
common
cold
stuff.
to directly like a black fungus.
Wow.
If you remember in the second wave of COVID,
Right,
when
right.
we had all those mucormycosis cases.
Right.
So it's a very, very vast branch.
So, what is the most common things that people come to you with?
Well, most of the times we have a branch which has half of patients coming walk-in as OPD patients who have cough, cold, violent
Right,
fevers,
right.
earaches, and half of them come for surgical procedures,
Hmm.
which are like sinusitis, like ear infections. And now the branch has extended into borderline levels where we do rhino neurosurgery, auto neurosurgery. So we go through the nose and help a neurosurgeon to do a pituitary, or
Okay.
go through the ear and with a neurosurgeon we do something called as glomus tumor. So that's how, you know, it's a very, very extensive branch where we are doing almost everything.
Okay.
Small ones and large ones.
Right. And more from the preventive side, or from the health side, what can we do to good habits for particularly for your ear, nose, and throat? Like
Yeah,
steaming,
it's like-
hot water. What are the kind of things that you generally tell people to do, just as good practice?
Yeah, now if you ask me, the most common part which I would ask young people to do is try to minimize the use of a earphone.
Okay.
Because you
Right.
know, at present the number of people who are using earphones and the
Yeah.
number of hours they are using
Right.
is really frightening.
Hmm.
And if you think about it, earphone has come maybe 20 years back.
Right.
Before that, in millions of years, nobody had delivered the sound so close to the tympanic membrane.
Hmm.
So that creates what kind of an impression that creates, we still don't know.
Okay.
Second thing is, what about the radiation from the phones? Yeah, what kind of effect it is making? Already there are studies which say excessive cell phone use can cause brain tumors.
Mhm.
So we don't know. Cell phones are also maybe after 2000 they have come. So 20 years in our life, cell phone are there. Before that, they were not there. So we still don't know what
Nobody out.
exactly is happening.
Hmm.
So it is always wiser to use these things at a moderation.
Okay. Interesting about but coming back to the headphones, a little bit more detailed about that. Are you saying that more from the standpoint because it tends to be too loud that people listen to, or now with newer technology with noise cancelling and things like that, is that also becoming a problem even though they may not be listening to
The
loud
problem
music,
with
or is
all
it-
this technology is, see, usually a medical diagnosis is
Hmm.
made after years of observing patient what is happening to them.
Okay.
And these technologies are changing so fast that
Hmm.
we are still not exactly sure what is giving rise to what.
That's what you said.
So
Yeah.
nowadays I'm advising many people to use a bone conduction earphones, because
Oh, the ones
normal
that are
earphones, yeah,
outside, right.
yeah, outside, because the normal earphones, people are coming with too much wax.
Yeah.
People are coming with ringing noises in the ear in young people.
Right.
So that is something where the technology is moving so fast
Hmm.
that medicine is unable to catch up. We don't know what is happening because
Hmm.
of what. So what we would say is that if a new technology comes, try to keep it at a minimum. Don't get completely addicted to that.
Yeah.
Yeah.
Okay.
Because nowadays we see many young people coming with neck pain, shoulder pain. Slowly we realize that this is because of the posture
Yeah.
while observing a phone.
Hmm.
So, we are also learning with this.
Yeah.
Now, if you look at young people having throat problems, you will see many people coming with recurrent clearing of the throat. Now, slowly, we realize that this is all happening because of reflux, acid reflux. Many people have dry cough
Yeah.
for months together,
Okay.
and they take antibiotics. They go to pulmonologist, sometimes undergo bronchoscopies, and then they become better with a 10 days course of antacids.
Okay.
So this is
With
something
antacids, interesting. Yeah, the
So,
correlation you don't think of. Huh?
people usually don't know.
Hmm.
And the problem is they don't believe us also. Because if I tell you that, look, your throat problem or your cough is because of acidity, the first thing he fights it is, I don't have any acidity problem. Now, there are two types of acidities. One is because of the lower sphincter, one is because of the upper sphincter.
Yeah.
And the cough, etc., is coming because of the upper sphincter. And then you are not getting the classical symptoms of acidity. So these are all new things which were not taught to me when I was doing it.
Right.
So this is all the knowledge which has come later on because of changing environment,
Yeah.
changing habits of people.
Well, speaking of changing habits, what about the changing of environments? Are you finding that air pollution are you starting to see more an effect of that?
If you sit with me in the OPD, you will see half of the patients come with nasal complaints.
Right.
They have nasal blockade, they have running nose, they have multiple sneezing. Then slowly this develops into nasal polyps, sinusitis. So all this are the effects of living in a city. There are so much of pollution, there are so many vehicles around us, there are so much of noise around us.
Yeah.
Everything is having some effect or the other. It's a very slow effect. But we cannot go out. I cannot tell a person that, look, you have got a very bad nasal problem because you are living in a city.
Right.
Nobody has listened to me that you are going to change your address because you have a cold. But then this is happening. Every day we are seeing patients coming with multiple problems of allergic rhinitis and then slowly the complications of that. And this is the effect of environmental pollution.
And you're starting to see a rise in that, huh?
Multiple rise. Because when we were learning the kind of patients we used to see, now we see, this was all not taught to us.
Right.
This is happening because of the changing environment. And that's why we are relearning the whole branch.
Another big one would be obviously smokers that come to you.
Yeah.
How do you deal with them?
No, smokers, basic, as you know, the primary problem which happens because of smokers in tobacco users is cancer of the larynx, cancer of the oral cavity.
Right.
And if you don't know, when we started learning about these cancers, Pune had the largest numbers of oropharyngeal cancers in the world.
Wow.
This was the status. Yeah, this was the status.
But why is that?
When I started learning, probably because Pune had a better cancer registry. Because we were diagnosed properly, that is one thing.
So better
The second thing is cancer. Tobacco usage is rampant in cities as well as in nowadays. If you see, the smoking part is more seen in women than in men. So that is another change which has happened. And the smoking is being caused because obviously causing bronchitis, causing lung problems. But at the same time, chronic smoking also causes deafness. There are chronic smoking. So these are various effects of bad habits. Smoking, alcohol, all these things are happening at a very early age. They were also there few years back, 2 decades back. But then the patients, they used to come to us when maybe 40-year-old or 50-year-old.
Okay.
We are seeing these problems happening in the very young people.
Interesting.
Yeah.
Okay. Well, we'll just try and break down some myths and facts only you can do. Cotton buds, good, bad, are they the right way to clean ears?
I always ask everybody who is using a cotton bud, means who asked you to use a cotton bud? There is no medical advice anywhere that you should use a cotton bud. So normally ear cleaning has to be done by an expert.
Yeah.
But then if you try to do it yourself, what you do is you end up pushing whatever is in the ear inside.
So more wax or pushing in.
Natural. I mean, it is very, very beneficial to the company which makes cotton buds, or maybe to us. Definitely not to the patient.
Okay. So then how does one clean their ears then?
Well, normally ear cleaning is not.
Oh, you're saying that.
So there is a very well designed, very well engineered process. You have a joint of the jaw here in front of the ear. And that always has an effect of toothpaste-like effect on the outer ear canal.
Okay.
Wax is formed always in the outer part. So when you press your chewing, the wax automatically comes out. You push it inside and the same movement will push the wax inside.
Okay.
So you don't need the cleaning. Some people who have excessive wax production or some people who have very narrow ear canal,
Right.
they will have to go to an expert.
I see.
Yeah.
Okay. Next one. We already kind of talked about this, but still, loud music hearing damage is only temporary. Is that a myth or fact?
Well, it depends on the length.
How long you've
I
been doing
mean,
it?
because you can see that loud music and industrial noise,
Hmm.
people who work in industries over the years, if you do audiological investigations of those, 90% of them are found to have hearing losses in certain frequencies.
Right.
So if you keep on doing that for a long time, you will have come.
Right. You need antibiotics for every sore throat. Yes or no?
Absolutely wrong. Just now I told you,
Yeah.
all of them he has sore throats. Most of them are having it because of the reflux.
Well, sucks. Absolutely. Yeah.
And if you take antibiotics, the reflex increases.
Hmm.
You take painkillers, it will still.
Right.
Yeah.
Okay. Next one. Hearing aids makes your natural hearing worse.
No, absolutely not. That is absolutely wrong. If you wear specs because your vision go down, so specs, hearing aids are specs for the ear. It's the same
Okay.
thing.
Right. Okay. Interesting. So, a few more questions then. The strangest thing you've ever removed from a ear or a nose?
Foreign body is a very, very nice picture. I can make a 1 hour presentation on foreign body.
Okay.
So I have removed a live and walking on the tympanic membrane from the ear.
A live ant. So, it was still alive
Yeah, I
inside
used
also.
to have that video. If I try to find it, it will be there. That the ant very happily walking on the tympanic membrane. It was in a medical student did that happen.
Wow,
He had
that's
come
really-
running in the afternoon on a Sunday afternoon at 1 o'clock, and then I had removed that. I had to first kill it by putting some water inside, drown the ant, and then you remove because it is very difficult to catch a moving target.
Yeah. That's the first I've heard of catching a moving target in someone. Any other interesting things you removed?
Yeah. Another thing, this is a story which I tell all the time.
Yeah.
That there was an old lady who had come in one of the hospitals where I used to go, and she had difficulty in swallowing. So the first diagnosis is always cancer. So we are trying to
Diagnosis is cancer.
Yeah, basically, in an old lady, there is a difficulty in swallowing. We want to rule out the cancer. So somebody came for an endoscopy.
Yeah.
And the endoscope wouldn't go ahead. Something hard or left.
Oh, I see. It's wrong.
But then I was told that why I used to do rigid endoscopies at that time. I was told to see. And our protocol is, old ladies, you always ask, where is your denture?
Where's
So
your?
I said, your denture.
I see. Okay.
So she had a denture and asked her,
Right.
where is your denture? So she said, I have taken it out.
Huh.
So the first thing that then we tried, then there was really a big hard mass inside. And then we didn't know what is it. There are pathologists, and he said then there can be endogenous bone formation, etc. It's a high-fi case.
Yeah.
And then on a hunch, I asked her daughter-in-law, did she have a new denture? So she said, yes, the one which she is using now and she had removed is a old denture. She lost her new denture line 2 days back. And she had lost that denture in the esophagus. And the old type of dentures which has wires. So
Crazy.
we had to open the esophagus from outside.
Was she lucky that she didn't choke or anything like that? I suppose.
No, it didn't go in the airway. It went in the
Okay.
food.
In the
So the
esophagus.
only
Right,
problem
right.
was she couldn't eat. Yeah.
Okay. Yeah.
But I mean, this was something which is really, really interesting. And we had to later on take a outer cut because denture, which is why also got strongly
Okay.
fixed inside the esophagus.
Yeah. I'm sure you can write a book
Yeah,
about these kind of stories.
Yeah, we used to have a big tray of various foreign bodies removed.
Right.
Yeah.
Well, then final question then for you is that, with all your years of experience, what is the one big bit of advice that you'd like to leave people for their ENT health?
ENT health, try to not to try things which are not really known to you. Don't try to handle these things.
Right.
Although these hormones are not like heart or brain,
Right.
where you automatically will become careful.
Yeah.
But if you try to be careless eating these things, you may have.
Don't take it for
So don't
granted.
don't take it for granted.
Yeah.
As it is said in Citadel, don't take it for granted.
Yeah, absolutely. Well, thank you so much for being here, Doc. It's been very interesting and to
Yeah.
get your very practical advice as well. So thank you so much for being here.
Thank you very much.
Thank you. And
Pleasure.
thank you. And we hope you heard everything clearly today. Thank you all for being here, and we will see you all next week. But before you leave, do not forget to hit the like and subscribe button here at the bottom. Any comments that you may have, please do share those as well. And we will see you all next week.